and Bishop Michael Fuller from Word of Life Tabernacle, 5628 Nix Road. You're listening to Wake Up.
I am Sarah Alford, the pastor of Joy Fellowship Outreach Ministry, located at 18336 Highway 87 West in Tar Heel, North Carolina, and I am excited to be a sponsor of Wake Up.
Welcome to Cape Fear Valley's Making Rounds Live, broadcasting and streaming live from the WIDU Community Room.
The We Do Radio Network, WAGR in Lumberton, WYDU in Red Springs, and WEWO in Laurinburg.
Making Rounds Live on 99.7 FM, 1600 AM.
We air every second and fourth Tuesday of the month.
Making Rounds Live.
The purpose of this show is to bring you information on health and wellness.
Here's the host of Making Rounds Live, Omega Jones.
And thank you so much, Ray. Welcome to another edition of Cape Fear Valley Health's Making Rounds Live. I'm your host, Omega Jones, and March is Kidney Health Awareness Month. So guess what we're discussing today? Kidney health. And we have in the studio Dr. Moses Kumi. He is from Carolina Kidney Care. And not only is Dr. Kumi an amazing person, but he is also a member of Cape Fear Valley Health's medical staff for nephrology. So we're just going to call him a nephrologist today, if that's okay with everybody.
Yes, that's okay.
And now, before we get started, I do need to let everyone know that this broadcast, don't forget, it is for informational purposes only. This is not a time for you to self-diagnose, especially with what we're talking about today. So if you or a family member, you're suffering from anything that we may talk about today, what we want you to do is find yourself a healthcare professional. Now, we have a lot to go over, so let's get started. Ladies and gentlemen, please welcome to the broadcast Dr. Moses Kumi. Dr. Kumi, thank you so much for being with us today.
Thank you very much, Ms. Jones. I'm very excited to be here today. Every time I get the opportunity to talk about kidney disease, it's always exciting so that I can have the opportunity to educate folks about kidney disease, how to recognize it, the treatment, and how best to treat it, and to make life more comfortable for all of us. So it's a very common disease in our area here, and we need to know more about it.
And I will let everyone know, this is my personal endorsement. Dr. Kumi, he was Darvin's doctor, and he was also my mother's doctor. So I trust everything that this man and this doctor will tell us today. Now, Dr. Kumi, let's get started with the basics. What are our kidneys? What do they do? And why are they so important?
So our kidneys, we have there are two organs in the body, and they are very, very important organs that does a lot of things in our body. Now, the kidney's main function is to filter all the waste products that we make in the body. They are located at the back of the stomach, or the abdomen, and as blood goes through the kidney, it filters all the waste products and makes urine, which goes through two tiny tubes, which we call the ureters. So the ureters bring the urine to the bladder, and then it sits in the bladder until you have the sensation to urinate. Then it goes through the urethra and comes out. So we are constantly making urine, filling up the bladder, and then getting rid of it when it's time to come out. Now, each kidney has tiny apparatus, which we call the nephrons. So that's the filtration system in the kidney. And there are 1 million in each kidney. They're tiny, tiny filtration system. And this is where the filtration and getting rid of excess water occurs. Now, when it comes to the function of the kidney, there are quite a number. So we start with the waste, getting rid of the waste product. Every day we eat, we make waste. We break down the food we eat, and then we get rid of the waste products. The metabolisms that happens in the body, breakdown of muscles, breakdown of cells, all form waste products. Some of the waste we form called like urea if we don't get rid of urea, it's going to make you sick. You're going to feel weak. You're going to feel tired. Your potassium will go up. You have symptoms that make you sick. So it has to come out of the body. And it's the job of the kidneys to get rid of it. So that's one of the functions. Second, it gets rid of excess water. So if you drink a barrel of water a day, the body doesn't need all the water. So the excess has to come out. And it's the kidneys that filters or get rid of the excess water. The brain will produce a certain hormone that tells the kidney whether I need more water in the body or not. And if the body doesn't need more water, you're going to pee it out. So it controls water in the body as well. Now, and it also produces certain hormones. Now, we have some hormones called EPO, and it's a hormone that some athletes, sportsmen abuse to improve efficiency. So the EPO is produced, natural EPO is produced by the kidneys, goes to the bone marrow and make red cells to prevent us from getting anemic. So if your kidneys are not functioning well, you're not going to make enough EPO, and therefore you will be anemic. So that's one other function. There's another function like makes active, we call active vitamin D. So vitamin D is needed to absorb calcium from the food that we eat. So you don't have enough vitamin D, you're not going to absorb the calcium. So that's another function that the calcium does. And it also helps to control blood pressure. It helps you to dump salt and water so that your blood pressure doesn't go up. There's certain hormones that the kidney also controls so that our blood pressure doesn't stay up. So there's quite a number of functions that the kidney is involved. If you are exposed to a toxin, a poison, if you drink like ethylene glycol, which is poisonous to the body, the kidney will find a way to get rid of it out of the body. So it gets rid of all waste product, poisons, excess water, and then produces hormones.
I had no idea.
So,
Dr. Kumi, let's talk about kidney issues. Before the broadcast, you said that this was the kidney belt. And I made the comment, I was like, well, we're the blood pressure belt, we're the kidney belt. Why is this so?
So there are a number of factors that predisposes us here in the South to kidney disease. But kidney is a huge problem in our environment here. So usually when we talk about kidney disease, we're talking about like chronic kidney disease, where your kidney function is decreased for over a 3-month period. And when it gets to the advanced stages, you have what we call end-stage kidney disease. And that's when folks go on dialysis. Currently in America, over 15% of the population have chronic kidney disease. And that comes about 50 million people living with chronic kidney disease.
50 million
50 million people have chronic kidney disease, various stages of kidney disease. When you come to the dialysis population, majority of African Americans, about 35% of African Americans are on dialysis. So let's go back. African Americans make only 13% of the population. But when you come to the dialysis population, we are making 35% of the population. So we are 3 times more at risk than non-African Americans. So with that said, chronic kidney disease prevalence is really increasing, and it's very important we pay attention to it because it causes a lot of suffering and it causes a lot of death. In the whole world, over 800 million people are living with chronic kidney disease.
That's a lot of people.
There's a lot of people. Between 1990 and 2015, 2020, the death rate from kidney disease increased over 40%. So the death rate is increasing, it's not going down, it's getting worse. So it's a huge problem, both in our area here and globally. Here in North Carolina, we have over 1.3 million people with chronic kidney disease. And for dialysis, you have over almost 20,000 people on dialysis. So it's a huge problem in the environment. And like I said, the incidence keeps rising. When I came here 18 years ago, my practice, and we cover Robeson County and Cumberland County, we had about 600, I would say about 600, 700 patients on dialysis. Fast forward, now we have about 1,500 patients on dialysis. If you just listen to the numbers, you're going to say, that's not a big deal. But 20% of our patients die every year. So if I have 600 patients to start with, by the end of the year, among that 600 people, 120 will be dead by the end of the year. So if you think about that number, and then fast forward, we have 1,500 now. That is huge. So chronic kidney disease is a huge problem. It causes hospitalization. Most people with chronic kidney disease end up in the hospital and they die. So I'm glad we're talking about this subject and that people will be aware of the significance and how serious the disease is, so we can take it seriously.
Ladies and gentlemen, with us today, Dr. Moses Kumi on Making Rounds Live. Dr. Kumi is from Carolina Kidney Care, and he is also a nephrologist with Cape Fear Valley Health. So if you have any questions, what you can do is you can call WIDU. Miss Glenda will answer the phone. She will take your message for you, and she will make sure that we get that question answered. If you want to go on the air, we'll make sure that Paul gets you on the air. And if you're following us by way of Cape Fear Valley's Facebook page, what you can do is drop the question in the comment section of today's broadcast, and then you can watch Lindsay work. And don't forget that we're also on YouTube. So what I want you to do, finally, make sure you share the broadcast. We have a lot of information, a lot of important information today. And if you're like me, you really don't make an excellent middle person. So just share the broadcast, and then they can get the information firsthand. Once again, ladies and gentlemen, Dr. Moses Kumi in the studio. Dr. Kumi, the connection between diabetes and kidney health, how does one affect the other?
Diabetes is our number one enemy. Not just with kidney disease, but when it comes to most medical conditions. And unfortunately, the incidence of diabetes is rising. We make this joke. I have a friend who's an infectious disease doctor, and then we said, if you have to choose between HIV infection and diabetes, what will you choose? And we said, I would choose HIV. Because now we have medications that you can use to treat HIV. When it comes to diabetes, it destroys eyes. People go blind, very common cause of blindness, stroke, heart attacks, kidney disease, people cutting their legs, just to name a few. So it's a very serious condition that we deal with. And when it comes to kidney disease, diabetes is the number one cause of kidney disease. About 45% of kidney patients, or 45% of chronic kidney disease is caused by diabetes. You come to my dialysis clinics, most of the dialysis clinics, the patients you see, over 60%. Here in Fayetteville, 60% have diabetes that is there. So we know diabetes has to do with high sugar in the blood. Now, the sugar goes through the kidney. The kidney tries to filter the sugar. And by so doing, it causes inflammation in the filtration system in the kidney. So it causes this inflammation, and it causes scarring in the kidneys. So scar tissues form in the kidneys, which eventually takes over the normal function of the nephrons and therefore destroys the kidney. So the higher your blood sugars are, the longer you have blood sugars in your system, the more you're causing damage to your kidneys. And once that damage is done, you cannot reverse it. It becomes progressive. So yes, diabetes has a strong correlation with chronic kidney disease. Chronic kidney disease itself does not cause diabetes, but the diabetes is what will really destroy your kidneys.
we mentioned kidney issues, and when we mention kidney issues, are we talking about one type, or are we talking multiple things that fall into that category?
Yeah. So we talk about kidney disease. Most of the time when people talk about kidney disease, they are talking about the chronic kidney disease from the diabetes, from the high blood pressure, from some inflammatory disease that can damage the kidney. So we have that, the chronic kidney disease, the one that will also end up on dialysis. So that's one kidney issue. Secondly, we also talk about kidney stones. Someone can have kidney stones and have kidney issues. Kidney stone is very painful. A woman who have kidney stones would tell you it's more painful than having a baby.
Well, I don't want it. Okay.
So kidney stone is also another one kidney issue. And then the third one, a very important one, is cancer of the kidney cancer. So kidney cancer is also quite common in our area here. And when recognized early, is treatable. I think I will discuss later, maybe more about kidney cancer later on, but it's something that is good to recognize early. You see blood in your urine, don't discard it, just mention it to your doctor, and then have it evaluated. Some people also have frequent urinary infection or kidney infection, different from bladder infection. So you can have infection involving the kidney itself, because you may have some abnormality in the kidneys, like kidney cysts. Patients who have a lot of cysts in their kidneys tend to have infection in their kidneys. So these are some of the issues: the chronic kidney disease, kidney stones, cancer of the kidneys, and frequent infections of the kidney.
Everything that you're talking about, Dr. Kumi, to me, that would be a reason why we should all think about kidney health. But someone listening, someone watching, they're going to be like, yeah. So why should we all think about our kidney health and focus on our kidney health?
The short answer would be because it causes a lot of suffering and causes a lot of death. A lot of hospitalization. Most patients with chronic kidney disease have a very high rate of hospitalization for various, just for the fact that you have chronic kidney disease, it puts your body in some inflammatory states. You are prone to having pneumonia, you are prone to having heart problems, you're prone to having stroke. So having that chronic kidney disease really predisposes you to a lot of conditions that will lead you to getting admitted to the hospital. And as I mentioned as well, the death rate from chronic kidney disease is very high. So you want to be around for your loved ones. So, and it's important when we think about it, we'll do something about it. When you think about it, you will want to prevent it. So it's good to be aware of it, to help us prevent it, and then talk to your physician about it. So, and the physicians, the primary care doctors, also encourages them. I teach the residents a lot. I have always following me, and I stress the importance of early recognition. We recognize it early, and then we can treat and then prevent its complication. So it's very important that we all be aware of kidney health, and then we talk about it.
Ladies and gentlemen, in the studio, Dr. Moses Kumi on Cape Fear Valley Health's Making Rounds Live. When we return, we're going to ask him about those warning signs. We're going to talk to him about kidney cancer, and more. Cape Fear Valley Health's Making Rounds Live. Make sure you stay close.
We'll be right back with more of Making Rounds Live.
Cape Fear Valley's Making Rounds Live.
Broadcasting and streaming live from the WIDU Community Room on 99.7 FM, 1600 AM.
The We Do Radio Network.
This is Pastor Wilbert Blandon Jr. of Antioch Bible Fellowship Ministries, and you're listening to Wake Up.
Legal online sports betting in North Carolina has officially begun, but some organizations like North Carolina Family Policy Council are concerned about the growth of legal gambling. U.S. House Committee this morning will question former special counsel Robert Hur about his controversial report on President Biden's handling of classified documents. It has been a week since Super Tuesday and the North Carolina primary, and the analysis continues. Tom Jensen of Public Policy Polling in Raleigh tells NCN News among the races that experts are studying are the surprise results from the Superintendent of Public Instruction race. The Princess of Wales has apologized for confusion caused by her altering of a family photo released by the palace. European leaders are being warned they're unprepared for a coming climate emergency. Mike Rayleigh, NCN News.
I'm Jamie Monticelli, WIDU Radio News. Fayetteville police are investigating a shooting. Police responded to reports of a shooting on Durant Drive just after 6:30 p.m. Sunday. They found a person who had been shot multiple times. No other details have been released. As spring approaches, the American Red Cross is urging donors to give blood now to continue to strengthen the national blood supply. People of all blood types, but especially those with type O blood, are critical to ensuring hospitals can meet the daily demand for life-saving transfusions. During Red Cross Month in March, the Red Cross celebrates the volunteers and blood and platelet donors who are critical to ensuring those in need get relief and care. Help can't wait. To book a time to give, visit redcrossblood.org. You can download the Red Cross Blood Donor app or call 1-800-RED-CROSS. As a thank you, everyone who gives by March 25th will get a $10 e-gift card to a pet supply merchant of choice. From WIDU Radio, I'm Jamie Monticelli.
Make sure to dress in layers today. After a chilly start in the morning, we warm up into the upper 60s to lower 70s by this afternoon. We'll see plenty of sunshine. Tonight, we'll see a brief increase in clouds. It's still chilly with lows in the upper 30s to lower 40s, but it's even warmer tomorrow as our southwest wind kicks in. It'll be mostly sunny with highs in the low to mid 70s. I'm meteorologist Kat Campbell in the Weather Center.
Catch the vision. Join the team. My name is Pastor George Coney Jr. I'm a proud member of the Wake Up Committee, and I want to encourage you to join the team, catch the vision, because whatever you have that's good for the church is good for the team that we have here at WIDU. Catch the vision. Join the team.
Hello, this is Reverend Dr. Patania L. Island, pastor of Hood Memorial AME Zion Church, and I am inviting you to come out and join us every Sunday morning at 9:30 for our Sunday school, and at 11 o'clock our morning worship service. We have midweek service on Wednesday nights at 7 o'clock p.m., and every first Friday night is our Shabbat praise night at 7 o'clock p.m. Hood is on fire for the Lord. Don't you want to join us? Where no one in the kingdom got swagger like us.
Prom season is finally here. Venus Vogue has your dress. Our amazing sales team will help you find the perfect fit for your body type. We can also rent your date a tuxedo to match your dress. Don't forget to ask us about our limousine service to take you to your prom in style. Our ladies do their best to keep you in your budget, with some sale dresses as low as $99. Our selection, services, and prices are the key to an unforgettable prom night. Come to 2739 Bragg Boulevard, Fayetteville. Venus Vogue, we've got your dress.
This is Reverend Dr. Patania L. Island, pastor of Hood Memorial AME Zion Church, located at 2801 Rose Hill Road, right here in Fayetteville, North Carolina. And you're listening to Wake Up.
I am Bishop J.V. Porter, the senior pastor of Christ Cathedral, one church, multiple locations here in the city of Fayetteville, a proud sponsor of Wake Up. Together, we are making a difference in this community.
We now return to Making Rounds Live.
Cape Fear Valley's Making Rounds Live.
Broadcasting and streaming live on the WIDU network, 99.7 FM, 1600 AM. Here's Omega Jones.
And thank you so much, Ray. Welcome back to the second segment of Cape Fear Valley Health's Making Rounds Live. In the studio today, Dr. Moses Kumi. Dr. Kumi is from Carolina Kidney Care, and he is a nephrologist with Cape Fear Valley Health. And before we went into break, Dr. Kumi was talking about the different types of kidney disease. So now, what I want to go into, Dr. Kumi, are the warning signs. Are there any early warning signs that people need to be aware of?
Okay. Unfortunately, we don't have real early warning signs when it comes to kidney disease.
Okay.
So let's take for chronic kidney disease, like we're talking about. There are 5 stages of chronic kidney disease, and most of the time you won't have any symptoms until you get to the advanced stage. That's when your kidney function is less than maybe 15%, 15 to 20%. That's when you start having some symptoms. And some of the symptoms that you may feel are nausea, vomiting, lack of appetite, and therefore losing weight. Mm-hmm. You may notice increasing leg swelling, your fatigue most times, difficulty sleeping, itching, dry skin with itching, muscle cramping, and then your blood pressure becomes difficult to control. Wow. So these are the symptoms that you feel towards the end when you really get into end-stage kidney disease. So the only way to really pick up that you have early chronic kidney disease is to have a test done, either with a urine test and a blood test. Mm-hmm. So that's why it's so important to see your doctor frequently. It's very important everybody, any adult gets a primary care doctor. At least once a year you have your blood test done. And if it started and we see you have a kidney function in the 50, you start observing and making sure we treat what is causing it. That is how you're going to slow it down. Because the symptoms are not going to show until the function is way down and it will be too late. You cannot rescue it at that point. You cannot reverse the damage that has been done. There are some, if you have like kidney cancer, if you have a kidney cancer, most of the time you may see blood in the urine. If you're lucky, you may have pain in your back. That might prompt you to see a healthcare provider. Mm-hmm. But for majority of cases, there's no signs, there's no symptoms, there's no warning sign in the early stages.
So let's talk about kidney cancer, since we've mentioned that a few times. How would we even know? I mean, if you say there's no early warning signs, how do we even know that we could possibly have kidney cancer?
So the one that off the back can make you think about it is if you have a family history of kidney cancer, because there's a genetic predisposition, there's a family history involved there. So if you have a family history, family who's had a kidney cancer, that you can have yourself screened. Apart from that, if you have blood in the urine, so if you're somebody who sees a physician regularly, and we check your urine, sometimes you have what we call microscopic blood in the urine. You're not going to see it with your eyes, but we put the stick in there and it tells us there's blood in the urine. So if you have this persistent microscopic blood, that will prompt your doctor to do some imaging studies like ultrasound or CT scan, and then that will pick up something if there's any abnormality. If you have persistent back pain that is not going away, your doctor will do an ultrasound or a CT scan to find out what is causing that pain. So you may have some symptoms, or your physician may pick up something on a test, and that's how it will be found. So we use the word incidental finding. We were looking for something, and then we found it. I've had patients who were being evaluated for a lung disease. They had a CT scan of the lung. That shows the upper part of the kidney, and that's how we found out you have a tumor sitting on your kidney. So it's very important you see a doctor frequently, have blood tests done, have urine tests done, and then don't ignore some of these symptoms when they happen. Except if you're a young lady, because during your cycle you may have blood in your urine. That is normal. But if you're not having your cycle, you're a guy, you have blood in the urine, you got to pay attention to it.
Or if you're going through menopause as far as a woman.
Yes, that's also, you have to pay attention to that.
Dr. Kumi, you mentioned drinking water. Everyone, that's the new norm now. Everybody's drinking water. It's important, the best option. But are there any drinks that are especially bad for a person's kidneys?
Okay. So water is good. And we've been told ever since we're little, drink water is good. And that's the best type of fluid that one really needs to drink. We don't need to drink gallons of water a day. These days you see people with drinking gallons of water. Too much water also has its medical problems. Yes. Ideally, if you're a regular person, you're not working outside, doing manual labor, sweating a lot, 3 liters of water, which will be how many ounces? About 64, 68 ounces is enough for a normal individual. Okay. You drink too much water, you drive your sodium in your blood low, and that has serious health consequences. It causes memory issues, it causes bone problems, it causes falling, heart problems. So low sodium has a lot of medical problems associated with it. And it's all from drinking too much water. I had one lady come to my office. She was drinking about 6 to 8 liters of water a day, and her sodium had gone down so low, you can have a seizure from that. So water is good, but drink in moderation. You don't have to drink more than a gallon a day. Even 4 liters, that is too much water. Mm-hmm. So with that said, what other drinks can you have? So you can have juices, fine. But even with the juices, yes, they are good. They are better than sodas. But you're going to be very careful how much orange juice you drink, how much apple juice you're drinking. They are all loaded with sugar. And when you have too much sugar, we're talking about diabetes, we're talking about obesity, which all has health implications. Mm-hmm. So you can have your juices better than the soda, but you have to drink in moderation. Some folks will mix their juices with water just to dilute it and have less sugar. Coffee is okay. I hear a lot of people saying, I have kidney disease, I cannot drink coffee. That is not entirely true. You can have coffee. Coffee doesn't have a negative impact on the kidney. If you have kidney disease, especially advanced kidney disease, we want you to stay away from the dark soda, the dark drinks, because it has a lot of phosphorus, and that can have some implications in the body. So water, fruit juice are fine. Soda, we try to discourage drinking soda. Most people drinking soda want the regular soda, right, with the high sugar. And
what's the point?
What was the point? If I'm going to drink soda, then I should drink regular soda. Again, like we said, maybe a can of Coke has about more than 8 tablespoons of sugar put in it. It's a lot of sugar. Mm-hmm. And if you are diabetic, that's a problem. And even then, it adds to your daily requirement for calories. And even with the diet sodas, it's been found that they all have health implications. Effect on the bones, some heart problems associated with it, dental issues, because they all have some there's some type of sugar in it. Bacteria breaks it down, and then it destroys the enamel in the teeth. So sugary, non-sugary drinks are all not very good for the body. You can never go wrong with water.
What about foods? Are there foods that are good or bad for the kidneys?
So fruits, vegetables are good. Watch your calories. And when it comes to kidney disease, chronic kidney disease and food, we really don't have much restriction until your kidney function is really low, until you are in advanced stage. let's say when your kidney function is below 15-20, that is when we have some restriction. And the restriction involves like low potassium diet. We're going to restrict you on how many bananas to eat, how much potatoes to have, because they all have high potassium, how much orange juice to drink. So that is when we restrict some of these food items. Your phosphorus, food items that have high phosphorus, food items with a lot of salt. So when your function is around 30, 40, 50, there isn't much food restriction. But again, it's helpful if you eat healthy, more fruits and vegetables, less calorie intake, less fat back and all the stuff. if you can minimize and then eat well, that really helps. Yeah.
Well, you just messed it up for me, Dr. Kumi. What do you tell patients? What do you tell patients to improve their kidney health?
Again, the diet is very important. The type of drinks that we are having. See your doctor. And so for somebody who has normal kidney disease, just doing the basic healthy lifestyle is very important to maintain your kidneys. So you eat right, you drink right, you see a doctor at least once a year or once every 2 years if you're not on any medication, so that we can pick up some of this issue. If you have kidney disease, we can pick it up earlier and treat it. There are certain medications over the counter that we have to be careful of. We have the general term called non-steroidal, like Motrin, Advil, Aleve, ibuprofen, naproxen. All those medications, yes, they are good for inflammation, but they can hurt the kidney. If you have normal kidneys, you can take it from time to time, but not popping the Motrin 600, 800 milligrams frequently. You're going to cause damage to your kidney. Some heartburn medications like Protonix, Nexium, Omeprazole, the purple pill. So those are pills that can cause chronic kidney disease.
Really?
If you've had a stomach ulcer, you've had a condition that you need it to heal those ulcers, that is okay. But we have a lot of patients who take this medicine because they had some issue 2-3 years ago. It's long gone and they are still taking it. Discuss it with your primary care doctor. You may not be taking this medicine for the long haul. They do cause damage to the kidneys. Wow. So those are the two big medications that we got to be very careful of. And in this area, in our area here, BC powder. I did my training. I did my training in the northeast, and I never heard about BC powder until I came down south.
You come down south,
and
right.
You have people taking BC powder for their arthritis, and it's like Motrin. It's a non-steroidal, and it causes a lot of kidney issues down here. So that's another medication I want folks to try and, I won't say stay away completely, but minimize its use, even if you don't have kidney issues.
Dr. Kumi, you just wiped out everybody's medicine cabinet in the county and in the area. I just want you to know that.
NSAIDs, yes, the NSAIDs, the non-steroidal anti-inflammatories, yes.
What about folks that have healthy kidneys? What do you want, and they want to keep those healthy kidneys? Diet, lifestyle, see your doctor?
See your doctor. And again, all these medicines that we mentioned,
yes,
they have it in their medicine cabinet. I'm not saying throw them away, but minimize their use, and you will preserve your kidney function.
But Dr. Kumi, when you get a toothache, there's nothing better than an ibuprofen. I'm
Again,
sorry.
yes. So you can. What we found is that is the amount and how long you take it.
Okay.
That is the most important thing. how much and how long you take it. So if you're popping it day in, day out, months after month, you're going to cause damage. But if, let's say, you had a toothache for 1 week, I had a dental work and I had to take Motrin 800 twice a day for a whole week, that's okay. But I'm not going to continue to take it for months. That's when we run into problems.
Now, you mentioned NSAIDs. What about acetaminophen?
So acetaminophen is very safe for the kidneys. It has its effect on the liver. So again, in moderation, if you take in 4 to 6 tablets a day, you are okay. As needed. You should be okay. Even with the liver, you should be okay. So acetaminophen, if you have pain, that's a preferred medicine to take rather than the non-steroidals. Apart from kidneys, research over the past 10 years or more has shown that the non-steroidals do cause a lot of heart disease. So the Motrin, the naproxen, yes, they're good for pain, and we're trying to stay away from it. So for elderly patients who have heart problems, you have to be careful taking all these non-steroidals. They do have effects, some problems on the heart.
Ladies and gentlemen, Dr. Moses Kumi on Making Rounds Live. Dr. Kumi, does race play a role in kidney health and the increased risk?
Yes, unfortunately, yes, it does. We have some socio-economic factors, and then we have some genetic factors. But first, let's talk about the socio-economic factors that affect health in general. So you look at educational level of folks. The more educated you are, the more informed you are, the more you pay attention to health issues, and therefore, health-wise, you do better. Income level. Low-income populations are known to have poor health outcomes, including chronic kidney disease. And insurability, folks who have insurance. You don't have insurance, you don't have access to care. So folks who don't have insurance and they're walking around with high blood pressure, diabetes, they don't have a primary care doctor they can go to every month or every 2 months. So what they do, they wait till they have a headache and they show up in the emergency room with a blood pressure of 200 over 100 and something. And that's when we have the strokes and the heart attacks and the kidney failure. Can't tell you how many times we have young people who walk through the emergency room and I have to go in there and tell them that, I'm sorry, we have to start dialysis. Like, what are you talking about? Because over the time, they've had blood pressure issues and has not been treated because they don't have insurance. So these are some of the social factors that really contribute to healthcare in general and dialysis in particular. Now, in our community, I mentioned African American community, we are really 3 times at risk for kidney disease. 3 times. 13% of the population, but on dialysis, 35% on dialysis. And these socioeconomic factors play a huge role. So, and there are some other factors. So let me give you some statistics. So nationally, so we're talking about income level. So nationally, we have about 20% of African Americans below the poverty level, as compared to 9% of non-African Americans, like white folks. So already you see the disparity, and it's huge. You talk about education. High school graduation rate amongst whites about almost 90%. Amongst African Americans, about 76%. You talk about uninsured, so about 11% in African Americans, 6% in non-African, almost twice. So if you're just looking at these numbers, you can see why there is disparity in healthcare. Not that it's just the system, it's just these are some socio-economic factors that is playing into this. Now, there's this program that they have, they call the Kidney Early Evaluation Program, looking at risk of kidney disease and dying. What they found was patients with no insurance, 72% of them were likely to develop end-stage kidney disease. So if, in simple English, if somebody had insurance, let's say 100 people had insurance and they are on dialysis, 172 of those without insurance are going to be on dialysis. That is huge. If you count millions, that's a lot of people. Now, you talk about private insurance. Compare those with no insurance to those who have private insurance, 82% are likely to die from chronic kidney disease. So just 82% compared to, so if you have 100 people who are dying with private insurance, you're going to have more than 82%, almost double that number without insurance, are going to die from some form of a kidney disease. So having insurance is so important. It helps you take care of the various causes of kidney disease, causes of heart disease, causes of stroke. So health literacy, which plays into educational level. The health illiteracy, so they've done studies looking at this. The health illiteracy rate among African Americans is 28% versus 5% of non-African Americans. So we have a lot of work to do. That's why it's so important to have educational programs, maybe in our communities, to educate our folks and to know some of these factors, some of these issues, to know what kidney disease is, be educated on. If you're a high school dropout, you're not going to go and read on kidney disease. So we have churches where we can reach out to folks in the church, folks in the community, to educate them on some of these issues. So there's social economic factors affecting healthcare when it comes to race.
Yeah.
Now, there's also some systemic issues, even when it comes to the medical community. Let's look at trials, clinical trials. So in 2011, there was this report where they were looking at engaging women and minorities in clinical trials. And what they found that African Americans represented in this study formed only 5% of the participants. So again, let me go to my 13%. We are 13% of the population, but only 5% of African Americans were included in this trial. In 2015, FDA approved a medication which is used for high potassium. We see high potassium in chronic kidney disease, so we see it in a lot of African Americans as well. African Americans made less than 1% of the participants in the study, about 5 out of 700 people.
Is that because we just don't participate in clinical trials?
Again, FDA approved a medication called Entresto, which is good for heart failure, prevents heart failure, hospitalization, death from heart failure, which helps our kidney patients. They had 8,400 participants. African Americans made only 5%. That is 428 of the patients. So some folks go back and said, why is this happening? And what they found out was most of the African American patients said, we were not asked. Some of them said, we're not aware. Some said, if they had given me more information or more education, maybe I might have participated. So going forward, changes have been made, improvements have been made to try and avoid this disparity, because a lot of these medications that are being tested are going to be used in African Americans. So it makes sense that we'll have adequate representation in testing these medications. So yes, that's why you have some of these disparities. So socioeconomic, some of these systemic in clinical trials. And then we have the big genetic factors. So for the longest time, we said, why are blacks having more kidney disease than whites? There were studies where they control socioeconomic factors, they control income, everything. still African Americans have more kidney disease than white folks. So let me tell you the story. At South Ramsey, I had this patient on dialysis. I'd been taking care of him for years. And he got admitted to the hospital one day, and I met the wife. So the wife came to me and said, Dr. Kumi, I've been waiting to talk to you. I said, why? He said, I have a problem with you. I said, what's the issue, ma'am? Her question was, why is there so much discrimination going on in your clinic? So what he meant was, why is there segregation in your clinic? You put only black people in your clinic. What is going on? So I smiled, and then she goes, that is not funny. I said, no, ma'am, it's not funny. But if I take you to all the 4 clinics in the Fayetteville area, this is the population you're going to see. Out of the 140 patients that were in South Ramsey Dialysis Clinic at that time, not more than 15 patients were white patients.
Wow.
So I say, ma'am, if I take you to North Ramsey, South Ramsey, West Fayetteville, all the clinics, you're going to see the same. She just looked at me and said, are you serious? I said, yes, I'm serious. So we know there's more disease in African Americans than non-African Americans. And a gene has been isolated. It's called the APOL1 gene. That when you have it, your risk for kidney disease is high. Your risk of progression of the disease is high. So you can have 2 individuals starting with the same kidney function, but one will progress within 2-3 years on dialysis. The other one, I've had patients 15-20 years, the kidney function is still the same where it is. So we're beginning to learn more about this gene, see how they can target this gene in the treatment, and see if it can help maybe prevent the incidence of kidney disease and its treatment.
Ladies and gentlemen, Dr. Moses Kumi in our studio today on Making Rounds Live. Dr. Kumi, what is the kidney disease risk index, and how does that work?
So they came out with this equation that really helps you to assess one's risk for kidney disease. Mm-hmm. And there are various factors or components that goes into this equation. So we use the age of the patient, because the older you are, the more at risk you are for kidney disease. Sex, men has higher risk than women. We factor that in. And then we look at the urine test. Your urine test looking out for protein or albumin in the urine. And then your, what we call the glomerular filtration rate, that's the creatinine. So these 4 factors goes into that index. So you plug it into the formula, and then it spills a percentage. And based on that percentage, it tells you your risk of developing kidney disease. There's a more comprehensive formula which incorporates, do you have diabetes, do you have high blood pressure, you have heart disease. So that's a more comprehensive formula. So these are there are various formulas that you can use, but it lets your doctor know your risk. So if you have one that tells you your risk is 20%, that is 20 to 40% range, mm-hmm. It tells you that in 2 years, you're likely to be on dialysis or get transplant. If it's low, less than 1, then your risk for kidney disease is really very low. So it helps us to categorize your risk for kidney disease and going onto dialysis or transplant.
Are there any screenings or prevention that you can recommend?
So screening for kidney disease, again, go back. There are 3 main ways: urine test, blood test. So for the urine test, we're looking for protein in the urine or albumin. Mm-hmm. We have protein in the blood. As the blood is going through the kidney, we get rid of some of the protein in the urine. But there's so little that we have to get rid of. If we get more than the normal, it means there's something going on in the kidney. Either infection, inflammation, something is going on in the kidney and needs attention. So if you have your urine test every year, if you start spilling protein, your doctor is going to notice it, and then we'll take a look at it. Then blood test. There's a test amongst the tests that the blood test you do called creatinine. Again, we make it from the food we eat. The muscles break down. We get rid of it. When that level is high, it means your kidneys are not doing a good job in getting rid of it. Therefore, you have kidney disease. And then thirdly, we do ultrasound. So we may not have a urine, we may not have a blood, but if I do an ultrasound and I see multiple cysts in your kidneys, you have chronic kidney disease. So you have to see a healthcare provider to be able to identify some of these issues. What we can do in our communities is churches can organize health fairs, and checking urine in healthcare is not that difficult. Get a urine sample, bring it, just dip it, and it will tell me if you have protein or not, and then from there we can even refer you to see a doctor. Blood test, that may be a little complicated. Blood pressure check. Tell you how many people are walking around with high blood pressure that they are not even aware of.
And blood pressure beats your kidneys.
Yes, and I have a lot of young African-American men. They come in, they have elevated blood pressure. For some reason, our kidneys are so that our blood pressures are high. African-Americans have more high blood pressure issues than non-African Americans. But most of our young men think they are too strong, and they don't see doctors, and they don't take their medication. So it's very important, even if they are not going to the hospital, doctors, if we can have an avenue where we can screen in the community, in the churches, that will go a long way to help.
Let's talk transplants. If someone is waiting for a kidney transplant, what is that wait list like? And I'm going to have to ask this question. Does health inequality become a factor?
Okay. So transplant is the best treatment for end-stage kidney disease. So currently we use dialysis is the most common form of treatment for end-stage kidney disease. But we wish to have a lot of our patients on transplant. Currently in America, we have over 550,000 people on dialysis. Medicare spend over $5 billion, the B, on dialysis alone. That is more than most countries, a lot of countries' budget for the year, $5 billion and counting. And for transplant, we have about 200 and something thousand patients living with transplants. Once you get transplant, your lifespan really improves. So the average dialysis patient's life expectancy is 5 to 10 years. Life expectancy. You go on dialysis, if you don't get transplant, you can die within 5 to 10 years, especially those who have diabetes. So that's thinking. Now, if you're on dialysis and you are waiting for transplant, those waiting for transplant, every day 13 people die waiting to get a kidney transplant. So transplant is very, very important, and we're spending a lot of time on kidney transplant. And the government is pushing that we get more people on transplant. Now, the problem is we don't have enough kidneys to go around. So currently in our region here, the wait time to get a kidney transplant is about 5 to 7 years. So if you start dialysis, you may have to be on dialysis for 5 to 7 years to get a kidney transplant. Now, if you see us early, so let's say you start seeing your doctor, your kidney function is 25, is dropping. Once it gets to 20 or less, we will refer you to the transplant center, Duke, Chapel Hill, Wake Forest. So they start seeing you, the evaluation process can be very long. It doesn't mean you need transplant at that time, but they get to know you, they run all the tests that needs to be run, and they keep your name in their data bank. And they will see you once a year until your kidney function drops to a point where you need a transplant. But by then, because they've been seeing you early, you are way up on the list. And you might not even have to start dialysis. I've had some patients who didn't even have to start dialysis because we sent them early and they got a transplant.
They got a transplant.
So, but otherwise, if you're on dialysis, it's going to take you 5 to 7 years. Now, you asked about racial differences or equity. Unfortunately, there are more African Americans on dialysis, but we don't become organ donors. So I'm using this opportunity, please appeal to our folks, our brothers, our sisters, our mothers need kidney. You can become a donor. I know there is suspicion in the system, there's mistrust, people don't trust the system. I've heard a lot of people say, if I'm a donor and I'm sick, I'm dying, they just want to let me die so they can get my organ. So I'm not going to be an organ donor. So let's make our organs available so that we can get transplants. So, and even when it comes to living transplants, African Americans are less willing to give their kidney to a family member. You go to non-African American, white folks, they'll easily do that. So that brings a disparity over there. Yeah. In terms of other social factors, so if I send you for transplant, let's say even African American, I send you to transplant or a patient, anyone at all, they require you, even if when you have insurance, they require you to have some amount of money that initially can help buy some of your medications. And a lot of our patients don't have that money even to put down. And that can delay transplant for 2-3 years. There are times that they have to have fundraising activities in their churches to raise that money to be able to be on the transplant list. So there are a lot of all these social, economic factors. You have to have somebody who will drive you. So before they will list you, you have to show that this is my caregiver, this is the person who's going to bring me for my appointment all the time. If you don't have anybody like that, you're not going to be listed. Because when they call you at 1 a.m. for a kidney, somebody has to drive you. So we have some barriers to transplants that needs some work on.
Dr. Kumi, they're telling me that our hour is up.
Already?
I have not gotten through all of the questions, so can we have you back?
Sure.
So we can continue this conversation?
Anytime.
All right. Ladies and gentlemen, Dr. Moses Kumi, and once again, Dr. Kumi, thank you so much for being on the broadcast. Dr. Kumi is with Carolina Kidney Care, and he is also a nephrologist with Cape Fear Valley Health. Ladies and gentlemen, our next broadcast is Tuesday, March 26th, so make sure you join us. We'll talk about colorectal and cervical cancer as well as birth defects. So, like I said, make sure you join us. For our producers, Shaka Jordan, Lindsey Graham, and Ray Thomas, and the hardworking team behind the scenes, I'm Omega Jones, continuing the legacy of Darvin Jones. Thanks for listening to Cape Fear Valley Health's Making Rounds Live.
Thank you.
Your station for inspiration and information. 1600 AM, 99.7 FM, WIDU1600.com. We are WIDU Fayetteville. We do radio. Follow us on Facebook at WIDU 1600 AM.
At CI News, I'm Mike Rayleigh. Legal online sports betting in North Carolina has officially begun. John Rustin of the North Carolina Family Policy Council is concerned about the growth of legal gambling.
It's not just about the potential for jobs and the potential for revenue to be poured into the state budget, but there's a real human aspect and a real human cost of this. It's not good for families, it's not good for individuals, and it's certainly not good for communities.
Confirmation this morning from Israel and the White House that an Israeli-American